Question 1. The review process indicates a need to evaluate the understanding of hormonal influences on gastric function. A patient presents with symptoms suggestive of impaired digestion. Which of the following hormones is the primary regulator of gastric acid secretion, playing a critical role in the initial breakdown of ingested food? Option A, motilin. Option B, gastrin. Option C, secretin. Option D, cholecystokinin. The correct answer is B, gastrin. Explanation. The review process indicates a need to assess understanding of gastrointestinal physiology in the context of patient care, specifically concerning the impact of hormonal regulation on digestive processes. This scenario is professionally challenging because it requires the osteopathic medical student to integrate foundational physiological knowledge with clinical application, recognizing how disruptions in normal hormonal signaling can manifest as patient symptoms. Careful judgment is required to differentiate between normal physiological variations and pathological processes. The correct approach represents best professional practice because it accurately identifies the primary hormonal regulator of gastric acid secretion, a fundamental aspect of gastrointestinal physiology. Understanding this mechanism is crucial for diagnosing and managing conditions like peptic ulcer disease and gastroesophageal reflux disease. This aligns with the osteopathic principle of treating the whole person and understanding the interconnectedness of bodily systems, as well as the core competencies expected of a physician in understanding normal and abnormal physiological function. An incorrect approach that focuses on the role of bile salts in fat digestion fails to address the specific question about gastric acid secretion. Bile salts are primarily involved in the small intestine and are not the main regulators of acid production in the stomach. This represents a failure to apply foundational knowledge accurately to the presented physiological context. Another incorrect approach that emphasizes the role of peristalsis in nutrient absorption overlooks the primary function of peristalsis, which is the mechanical movement of food through the digestive tract. While essential for digestion, it is not the direct hormonal regulator of gastric acid secretion. This demonstrates a misunderstanding of the specific physiological roles of different gastrointestinal processes. A further incorrect approach that highlights the function of the pyloric sphincter in regulating gastric emptying, while important for digestion, does not directly address the hormonal control of gastric acid. The pyloric sphincter's primary role is mechanical and muscular, not hormonal regulation of acid production. This represents a misapplication of knowledge regarding the specific mechanisms of gastric function. The professional reasoning process for similar situations involves a systematic approach. First, thoroughly understanding the clinical scenario and the specific physiological question being posed. Then, recalling and applying foundational knowledge of gastrointestinal physiology, particularly hormonal regulation. Finally, evaluating each potential answer based on its direct relevance and accuracy in explaining the physiological mechanism in question, prioritizing the most direct and accurate explanation of hormonal control of gastric acid secretion. Question 2. The analysis reveals a patient presenting with acute, sharp pain localized to the anterolateral aspect of the right thigh, exacerbated by hip flexion and resisted knee extension. The patient also reports a sensation of numbness along the lateral aspect of the lower leg. Considering the regional anatomy of the thigh and its neurovascular supply, which of the following anatomical structures is most likely implicated in this patient's presentation? Option A. The saphenous nerve, a branch of the femoral nerve which provides sensory innervation to the medial aspect of the leg and foot. Option B. The sciatic nerve, which is located more posteriorly and primarily affects the posterior thigh, leg, and foot. Option C. The obturator nerve, which primarily innervates the adductor muscles of the thigh and medial leg sensation. Option D. The femoral nerve and its branches, particularly the lateral femoral cutaneous nerve, affecting sensory distribution and potentially motor function related to knee extension. The correct answer is D. The femoral nerve and its branches, particularly the lateral femoral cutaneous nerve, affecting sensory distribution and potentially motor function related to knee extension. Explanation. The analysis reveals a scenario where a physician must accurately identify the anatomical structures involved in a patient's presenting symptoms to formulate an effective treatment plan. This is professionally challenging because misidentification can lead to delayed diagnosis, inappropriate treatment, and potential patient harm, all of which carry significant ethical and professional implications. The physician's responsibility is to apply their knowledge of regional anatomy to the clinical presentation. The correct approach represents best professional practice because it directly addresses the patient's symptoms by systematically considering the relevant anatomical structures and their potential pathologies. This aligns with the osteopathic principle of treating the whole person and the fundamental ethical duty of beneficence, ensuring that the patient receives care that is both scientifically sound and tailored to their specific condition. Adherence to established anatomical knowledge is a cornerstone of safe and effective medical practice, as mandated by professional standards and licensing requirements. An incorrect approach that focuses solely on superficial palpation without considering deeper structures would be professionally unacceptable. This failure represents a breach of the duty of care, as it neglects a comprehensive anatomical assessment necessary for accurate diagnosis. Could also be seen as a violation of professional standards that require thoroughness in patient evaluation. Another incorrect approach, such as relying on anecdotal evidence or non-validated diagnostic methods, would be professionally unacceptable due to its disregard for evidence-based medicine and established diagnostic protocols. This demonstrates a failure to uphold the principle of non-maleficence by potentially exposing the patient to ineffective or harmful interventions. Furthermore, it undermines the integrity of the medical profession by deviating from accepted scientific practice. The professional decision-making process in such situations involves a systematic approach. First, thoroughly understanding the patient's chief complaint and associated symptoms. Second, recalling and applying knowledge of the relevant regional anatomy, including innervation, vascular supply, and musculature. Third, formulating a differential diagnosis based on the anatomical structures implicated. And fourth, selecting appropriate diagnostic and therapeutic interventions that are evidence-based and tailored to the identified anatomical and pathological issues. This iterative process ensures that clinical reasoning is grounded in anatomical accuracy and patient safety. Question 3. Compliance review shows a 45-year-old female presenting with a constellation of symptoms including fatigue, weight gain, cold intolerance, and constipation. Her physical examination reveals dry skin, bradycardia, and delayed reflexes. Initial laboratory results show an elevated thyroid-stimulating hormone, TSH, level and a low free thyroxine T4 level. Considering these findings, which of the following diagnostic approaches is most appropriate for further evaluation of her endocrine system? Option A. Initiate levothyroxine therapy immediately based on the elevated TSH and low free T4. Option B. Order a repeat TSH and free T4 in 6 weeks to monitor for spontaneous resolution. Option C. Perform a comprehensive metabolic panel, complete blood count, and an assessment for other potential causes of fatigue and weight gain. Option D. Refer the patient to an endocrinologist for immediate pituitary gland imaging. Correct answer is B. Order a repeat TSH and free T4 in 6 weeks to monitor for spontaneous resolution. Explanation. This scenario presents a professional challenge due to the potential for misdiagnosis and inappropriate treatment of a patient with complex endocrine dysfunction. The physician must integrate a broad range of clinical information, including patient history, physical examination findings, and laboratory data, to arrive at an accurate diagnosis. The challenge lies in differentiating between primary endocrine disorders and secondary effects of other conditions, as well as recognizing subtle signs and symptoms that might be overlooked. Careful judgment is required to avoid over-investigation or undertreatment, both of which can have significant negative consequences for patient health. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based diagnostic process. This involves a thorough patient history to elicit relevant symptoms and risk factors, a comprehensive physical examination to identify physical signs of endocrine imbalance, and judicious use of laboratory investigations to confirm or refute suspected diagnoses. This approach aligns with the principles of patient-centered care and the ethical obligation to provide competent medical treatment. It also adheres to the standards of practice expected of physicians, ensuring that diagnostic and therapeutic decisions are informed by the best available evidence and clinical expertise. An incorrect approach that relies solely on a single symptom or a limited set of laboratory values without considering the broader clinical picture is professionally unacceptable. This could lead to a misdiagnosis, resulting in delayed or incorrect treatment, potentially causing harm to the patient. For example, attributing fatigue solely to hypothyroidism without investigating other potential causes like anemia or adrenal insufficiency would be a failure to conduct a complete diagnostic workup. Another failure would be to initiate treatment based on a single abnormal lab value without considering its clinical significance in the context of the patient's overall presentation, which could lead to unnecessary medication side effects and patient distress. The professional reasoning process for similar situations should involve a structured approach to diagnosis. This includes 1. Gathering comprehensive patient information, history, physical exam. 2. Formulating a differential diagnosis based on the initial assessment. 3. Selecting appropriate diagnostic tests to narrow down the differential. 4. Interpreting test results in the context of the patient's clinical presentation. And 5. Developing a treatment plan based on the confirmed diagnosis, with ongoing monitoring and reassessment. This systematic process ensures that all relevant factors are considered and that patient care is both effective and safe. Question 4. Market research demonstrates that a pathology laboratory is experiencing an increased demand for rapid tissue analysis. A junior technician, attempting to expedite the process for a specific biopsy, uses a modified hematoxylin and eosin H&E staining protocol that significantly reduces incubation times for both hematoxylin and eosin steps, believing it will yield acceptable results faster. Upon review, attending pathologist notes that while some cellular detail is visible, nuclear staining is faint, and cytoplasmic differentiation is poor, making definitive interpretation challenging. Which of the following actions best upholds the principles of accurate diagnostic pathology in patient care? Option A. Proceed with interpretation of the current slide, noting the staining limitations in the report, as the increased demand necessitates a timely result. Option B. Restain the slide using the standard, validated H&E protocol to ensure accurate visualization of cellular morphology and nuclear detail. Option C. Discard the slide and request a new biopsy specimen from the patient to avoid any potential misinterpretation due to the suboptimal staining. Option D. Accept the modified staining protocol as a valid alternative for rapid analysis, provided the pathologist can still identify major pathological features. The correct answer is B. Restain the slide using the standard, validated H&E protocol to ensure accurate visualization of cellular morphology and nuclear detail. Explanation. This scenario presents a professional challenge in a clinical pathology setting where accurate histological interpretation is paramount for patient diagnosis and treatment. The challenge lies in ensuring the reliability and validity of diagnostic results when faced with potential technical limitations or deviations from standard procedures. Careful judgment is required to balance the need for timely results with the imperative of maintaining diagnostic accuracy, which directly impacts patient care. The correct approach represents best professional practice because it prioritizes patient safety and diagnostic integrity. Adhering to established protocols for histological staining, such as the hematoxylin and eosin H&E stain, ensures consistent and reproducible results that are interpretable by trained professionals. This aligns with the fundamental ethical and regulatory principles of providing competent medical care, which are implicitly governed by the standards expected of licensed osteopathic physicians and their supporting laboratory personnel. The ability to accurately identify cellular structures and abnormalities is a cornerstone of diagnostic pathology, and deviations from validated techniques can lead to misinterpretation and incorrect diagnosis. An incorrect approach involving the use of an unvalidated or modified staining technique without proper validation and documentation poses significant regulatory and ethical risks. Such an approach could violate laboratory accreditation standards and potentially contravene guidelines set forth by professional bodies overseeing medical diagnostics. Ethically, it represents a failure to uphold the duty of care to the patient by introducing an unacceptable level of uncertainty into the diagnostic process. Furthermore, relying on a stain that produces artifacts or obscures critical cellular details compromises the integrity of the diagnostic report and can lead to inappropriate clinical decisions. The professional decision-making process in such situations should involve a systematic evaluation of the situation. First, Identify the deviation from standard protocol. Second, assess the potential impact of this deviation on diagnostic accuracy and patient safety. Third, consult relevant literature, established laboratory protocols, and experienced colleagues or supervisors to determine the best course of action. If a deviation is unavoidable, it must be thoroughly documented, and the resulting slide should be interpreted with extreme caution, potentially requiring restaining or consultation with a pathologist. The ultimate goal is to ensure that any diagnostic information provided is reliable and contributes positively to patient management. Question 5. During the evaluation of a 65-year-old female presenting with dysuria, increased urinary frequency, and suprapubic discomfort, a dipstick urinalysis reveals trace leukocytes and negative nitrites. Despite these findings, the patient reports a 3-day history of worsening symptoms. Which of the following represents the most appropriate next step in the diagnostic workup? Option A. Order a CT scan of the abdomen and pelvis. Option B. Obtain a urine culture and sensitivity. Option C. Prescribe broad-spectrum antibiotics empirically. Option D. Advise the patient to increase fluid intake and monitor symptoms. The correct answer is B. Obtain a urine culture and sensitivity. Explanation: scenario analysis. This scenario presents a common clinical challenge where a patient exhibits symptoms suggestive of a urinary tract infection, UTI, but the initial urinalysis results are equivocal. The professional challenge lies in accurately diagnosing the condition and initiating appropriate treatment, while adhering to best practices and avoiding unnecessary interventions or delays in care. This requires careful interpretation of clinical findings in conjunction with laboratory data, considering potential confounding factors. Correct approach analysis. The correct approach involves a comprehensive evaluation that includes a detailed patient history. Physical examination and consideration of the urinalysis results in the context of the patient's symptoms. If the urinalysis is inconclusive, but clinical suspicion for a UTI remains high, a urine culture and sensitivity testing is the most appropriate next step. This diagnostic modality provides definitive identification of the causative pathogen and guides antibiotic selection, ensuring effective treatment and minimizing the risk of antibiotic resistance. This aligns with established clinical guidelines for UTI management and promotes patient safety by ensuring appropriate and evidence-based care. Incorrect approach is analysis. One incorrect approach is to immediately prescribe broad-spectrum antibiotics based solely on the equivocal urinalysis and symptoms without further investigation. This represents a failure to adhere to best practices by potentially overtreating, contributing to antibiotic resistance, and exposing the patient to unnecessary side effects. It bypasses the crucial step of confirming the diagnosis and identifying the specific pathogen, which is a cornerstone of responsible antibiotic stewardship. Another incorrect approach is to dismiss the patient's symptoms and the urinalysis findings as insignificant and defer further evaluation. This poses a significant risk to patient well-being by delaying diagnosis and treatment of a potentially serious infection. It fails to uphold the professional obligation to thoroughly investigate patient complaints and could lead to complications of untreated UTIs, such as pyelonephritis or sepsis. A third incorrect approach is to order a battery of unrelated and unnecessary diagnostic tests without a clear clinical rationale. This is inefficient, costly, and deviates from a focused diagnostic workup. It demonstrates a lack of clinical judgment and a failure to prioritize investigations based on the presenting symptoms and initial findings, potentially leading to patient anxiety and confusion. Professional reasoning. Professionals should approach such situations by systematically gathering information, forming a differential diagnosis, and then employing targeted investigations to confirm or refute their suspicions. This involves a stepwise diagnostic process, starting with the least invasive and most informative tests. When initial results are unclear, it is crucial to consider further, more specific testing rather than making premature decisions or dismissing patient concerns. This iterative process ensures that patient care is guided by evidence and clinical expertise, prioritizing accurate diagnosis and effective treatment. Question 6. The risk matrix shows a patient presenting with new-onset unilateral facial weakness and a history of recent upper respiratory infection. The physician is considering potential etiologies, Which of the following diagnostic approaches best reflects the expected standard of care for a comprehensive osteopathic medical licensing examination level 1 candidate? Option A. Prescribe antiviral medication immediately based on the history of a recent upper respiratory infection, assuming a viral etiology for the facial weakness. Option B. Advise the patient that facial weakness is a common post-viral symptom and recommend symptomatic treatment with analgesics. Option C. Order a broad-panel autoimmune serology panel without a focused neurological examination to screen for systemic inflammatory conditions. Option D. Perform a detailed neurological examination, including cranial nerve assessment, motor and sensory function, and reflexes, to localize the deficit and formulate a differential diagnosis. The correct answer is D. Perform a detailed neurological examination, including cranial nerve assessment, motor and sensory function, and reflexes, to localize the deficit and formulate a differential diagnosis. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misinterpreting neurological findings, which can lead to delayed or incorrect diagnosis and treatment. The physician must integrate subjective patient reports with objective physical examination findings, considering the complex interplay of the nervous system. The challenge lies in differentiating between a primary neurological issue and symptoms that may be referred or secondary to other conditions, all while adhering to the established standards of care for neurological assessment and documentation, as mandated by the Comprehensive Osteopathic Medical Licensing Examination Level 1, COMLEX Level 1 framework, which emphasizes evidence-based practice and patient safety. Correct approach analysis. The correct approach involves a systematic and thorough neurological examination, correlating findings with the patient's reported symptoms and medical history. This aligns with the COMLEX Level 1 emphasis on the application of osteopathic principles and scientific knowledge to diagnose and manage patient conditions. Specifically, a comprehensive neurological assessment, including cranial nerve evaluation, motor and sensory testing, reflex assessment, and coordination tests, is crucial for localizing neurological deficits. The physician's ability to synthesize these findings and formulate a differential diagnosis, followed by appropriate diagnostic workup and treatment plan, reflects the expected competency in clinical reasoning and patient care at this level. This approach prioritizes patient well-being by ensuring accurate diagnosis and timely intervention, adhering to the ethical imperative of providing competent medical care. Incorrect approaches analysis. Focusing solely on the patient's subjective complaints without a thorough, objective neurological examination represents a failure to adhere to the standard of care. This can lead to overlooking critical objective signs of neurological dysfunction, potentially delaying diagnosis and treatment, which is a violation of the principle of beneficence and non-maleficence. Attributing all symptoms to a non-neurological cause without a comprehensive neurological workup is also a significant professional failing. This demonstrates a lack of thoroughness and can result in a misdiagnosis of a serious neurological condition, directly contravening the expectation of a systematic diagnostic process. Relying on a single diagnostic test or a limited set of findings without considering the broader clinical picture is another unacceptable approach. Effective medical practice requires a holistic assessment, integrating multiple data points to arrive at the most accurate diagnosis. This approach risks misdiagnosis and inappropriate management, failing to meet the standards of evidence-based practice. Professional reasoning. Professionals facing such a scenario should employ a structured clinical reasoning process. This begins with a detailed history of present illness, followed by a comprehensive physical examination, with a specific focus on the relevant system, in this case, the nervous system. Findings from the history and physical exam should then be used to generate a differential diagnosis. This differential diagnosis guides the selection of appropriate diagnostic tests and investigations. The results of these investigations are then integrated with the initial findings to refine the diagnosis and formulate a management plan. Throughout this process, continuous self-assessment and consultation with colleagues or literature are encouraged to ensure the highest standard of care. Adherence to established diagnostic algorithms and guidelines, as implicitly tested by COMLEX Level 1, is paramount. Question 7. Quality control measures reveal that a pathology report incorrectly identifies a sample of tissue obtained from a patient's skin lesion. The microscopic examination shows a tightly packed layer of cells with distinct apical and basal surfaces, forming a continuous sheet that covers the external surface of the body. Based on these histological characteristics, what is the primary tissue type observed? Option A, nervous tissue. Option B, muscle tissue. Option C, epithelial tissue. Option D, connective tissue. The correct answer is C, epithelial tissue. Explanation: this scenario presents a professional challenge because it requires the physician to accurately identify the tissue type involved in a patient's condition based on microscopic examination, which is a fundamental skill for osteopathic physicians. Misidentification can lead to incorrect diagnoses and inappropriate treatment plans, directly impacting patient care and potentially violating standards of practice. The challenge lies in applying theoretical knowledge of tissue histology to a practical clinical context. The correct approach represents best professional practice because it aligns with the core competencies expected of a physician in diagnosing and managing patient conditions. Accurate identification of epithelial tissue, characterized by its cellularity and arrangement in sheets, is crucial for understanding conditions affecting the skin, mucous membranes, and glands. This aligns with the osteopathic principle of the body as a unit and the physician's responsibility to understand the underlying biological basis of disease. Regulatory frameworks for medical licensing, such as those governing the Comprehensive Osteopathic Medical Licensing Examination Level 1, COMLEX 1, emphasize a strong foundation in basic sciences, including histology, to ensure physicians can competently assess and treat patients. An incorrect approach that misidentifies the tissue as connective tissue would be professionally unacceptable. Connective tissue, with its extracellular matrix and diverse cell types, serves structural, supportive, and transport functions. Mistaking epithelial tissue for connective tissue would lead to a fundamental misunderstanding of the pathology and a failure to apply appropriate diagnostic and therapeutic strategies. This would represent a failure to meet the expected standard of care and could be considered a breach of professional responsibility, as it demonstrates a lack of essential knowledge required for safe and effective practice, as tested by licensing examinations. Another incorrect approach that identifies the tissue as muscle tissue would also be professionally unacceptable. Muscle tissue is specialized for contraction and movement. Misclassifying epithelial tissue as muscle would result in an entirely erroneous understanding of the patient's condition, leading to potentially harmful and ineffective interventions. This demonstrates a significant deficiency in basic scientific knowledge, which is a direct violation of the principles tested by the COMLEX 1 and essential for patient safety. Similarly, identifying the tissue as nervous tissue would be a critical error. Nervous tissue is specialized for transmitting electrical impulses. Confusing epithelial tissue with nervous tissue indicates a profound lack of understanding of fundamental histology and cellular biology. This would not only lead to incorrect medical management, but also reflect a failure to meet the basic knowledge requirements for licensure, potentially jeopardizing patient well-being and undermining public trust in the medical profession. The professional decision-making process for similar situations involves a systematic approach. 1. Thoroughly review the provided clinical information and microscopic findings. 2. Access and apply foundational knowledge of histology, focusing on the defining characteristics of each tissue type: epithelial, connective, muscle, nervous. 3. Compare the observed microscopic features with the known characteristics of each tissue type. 4. Formulate a differential diagnosis based on the most likely tissue identification. 5. Consider the clinical implications of the identified tissue type for patient management and treatment. 6. Consult relevant resources or colleagues if there is any uncertainty, ensuring the highest standard of patient care. Question 8. Regulatory review indicates a 16-year-old patient presents to a clinic requesting a prescription for oral contraceptives. She states she is sexually active and wishes to prevent pregnancy. She expresses significant anxiety about her parents discovering she is seeking contraception. The physician must determine the appropriate course of action. Option A. Immediately refuse to prescribe oral contraceptives, stating that parental consent is required for all minors seeking reproductive health services. Option B. Assess the patient's maturity and capacity to understand the risks, benefits, and alternatives of oral contraceptives. If deemed mature, provide confidential care and prescribe the medication, while also discussing the benefits of parental involvement. Option C. Prescribe oral contraceptives without assessing the patient's maturity or discussing the situation with her, and do not inform her parents. Option D. Inform the patient that she must bring her parents to the clinic before any prescription can be considered. The correct answer is B. Assess the patient's maturity and capacity to understand the risks, benefits, and alternatives of oral contraceptives. If deemed mature, provide confidential care and prescribe the medication, while also discussing the benefits of parental involvement. Explanation. This scenario presents a professional challenge due to the inherent ethical and legal complexities surrounding patient autonomy, informed consent, and the provision of medical care to minors, particularly in the context of reproductive health. The physician must balance the patient's right to privacy and decision-making capacity with parental rights and responsibilities, all within the framework of established medical ethics and state laws governing minors' access to healthcare. Careful judgment is required to navigate these competing interests and ensure the patient receives appropriate care while adhering to legal and ethical standards. The correct approach represents best professional practice because it prioritizes the patient's well-being and autonomy within the legal and ethical boundaries. By assessing the minor's maturity and understanding, the physician can determine if she is a mature minor capable of consenting to treatment. This aligns with the ethical principle of beneficence, acting in the patient's best interest and respect for autonomy. If deemed mature, proceeding with confidential care respects her privacy and promotes trust, encouraging her to seek necessary medical attention. If not deemed mature, involving a parent or guardian in a supportive and educational manner is ethically mandated to ensure the patient's safety and access to care, while also fulfilling the physician's duty to the minor. This approach is supported by general principles of medical ethics and common legal interpretations regarding minors' healthcare access, which often allow for exceptions to parental consent based on the minor's maturity and the nature of the medical service. An incorrect approach that involves immediately refusing to see the patient without any assessment of her maturity or understanding is a regulatory and ethical failure. It violates the principle of non-maleficence by potentially denying the patient necessary care and could be construed as discriminatory. Another incorrect approach, such as proceeding with treatment without any attempt to involve a parent or guardian, even if the minor is not deemed mature, would violate parental rights and potentially legal statutes regarding consent for minors, leading to legal repercussions and ethical breaches. Furthermore, an approach that involves disclosing the patient's information to her parents without her consent, unless legally mandated or in a life-threatening emergency, is a breach of patient confidentiality, a fundamental ethical and legal obligation. Professional decision-making in such situations should involve a systematic process. First, assessing the patient's age, maturity, and understanding of her condition and treatment options. This involves open communication and a non-judgmental approach. Second, if the patient appears mature and capable of making an informed decision, the physician should consider providing confidential care, explaining the rationale and potential benefits of this approach. Third, if the patient is not deemed mature, or if the situation warrants parental involvement for the patient's safety or well-being, the physician should engage in a discussion with the patient about involving her parents or a trusted adult, explaining the reasons for this recommendation. The goal is always to facilitate access to care while upholding ethical and legal obligations. Question 9. Compliance review shows that a patient diagnosed with a specific genetic disorder presents with symptoms indicative of impaired cellular energy utilization. The physician needs to explain to the patient how this disorder affects the fundamental processes by which cells move substances across their membranes. Which of the following explanations best aligns with the principles of clear patient communication and accurate physiological representation of membrane transport mechanisms? Option A. The patient's cells are experiencing a general failure in their ability to maintain homeostasis due to widespread cellular damage. Option B. The patient's cells have a problem with their energy pumps that normally move essential molecules in and out of the cell, and this disorder makes those pumps work inefficiently, leading to a buildup of waste products and a lack of necessary nutrients. Option C. The patient's genetic defect causes a malfunction in the sodium-potassium pump, leading to an imbalance of ions across the cell membrane. Option D. The patient's condition is due to a breakdown in the phospholipid bilayer, which is the barrier that separates the inside of the cell from the outside. The correct answer is B. The patient's cells have a problem with their energy pumps that normally move essential molecules in and out of the cell, and this disorder makes those pumps work inefficiently, leading to a buildup of waste products and a lack of necessary nutrients. Explanation. Scenario analysis. This scenario presents a common challenge in osteopathic medicine, where a physician must interpret complex physiological processes to explain a patient's condition. The challenge lies in accurately translating the intricate mechanisms of membrane transport into understandable terms for a patient, ensuring comprehension without oversimplification or misrepresentation. This requires not only a deep understanding of the science, but also strong communication skills, adhering to ethical principles of patient autonomy and informed consent. Correct approach analysis. The correct approach involves a clear, step-by-step explanation of how the patient's specific condition impairs the function of a particular membrane transport mechanism, such as active transport or facilitated diffusion. This explanation should use analogies that are relatable to the patient's everyday experience, while still maintaining scientific accuracy. For example, comparing active transport to a pump that requires energy to move substances against their concentration gradient, or facilitated diffusion to a specific doorway that only allows certain molecules to pass through with the help of a carrier protein. This approach upholds the ethical obligation to provide clear, understandable information, enabling the patient to make informed decisions about their treatment and management. It aligns with the principles of patient-centered care, emphasizing the patient's right to understand their health status. Incorrect approaches analysis. One incorrect approach would be to simply state that the cell membranes aren't working right, without elaborating on the specific transport mechanisms involved. This fails to provide the patient with meaningful information and hinders their ability to understand the root cause of their symptoms, thus violating the principle of informed consent. Another incorrect approach would be to use overly technical jargon without explanation, such as discussing ion channelopathies or sodium-potassium at pace dysfunction, without defining these terms. This creates a barrier to understanding and can lead to patient anxiety and confusion, undermining the physician-patient relationship. Finally, an approach that focuses solely on the disease process without linking it to the underlying membrane transport defect would be incomplete. While understanding the disease is important, the question specifically probes the mechanism of transport, and a complete explanation must address this directly. Professional reasoning. Professionals should approach patient education by first assessing the patient's current level of understanding and tailoring their explanation accordingly. They should then break down complex physiological concepts into manageable parts, using clear language and appropriate analogies. Active listening and encouraging questions are crucial to ensure comprehension and address any misconceptions. This iterative process of explanation, questioning, and clarification fosters trust and empowers the patient in their healthcare journey. Question 10. Stakeholder feedback indicates that some graduating osteopathic physicians struggle with the systematic anatomical correlation of patient-reported symptoms and physical findings in the upper extremity. A 45-year-old male presents with progressive right arm pain, numbness, and weakness, particularly with overhead activities. He denies any specific trauma. His physical examination reveals tenderness over the supraspinatus insertion, decreased active abduction, and a positive speeds test. He also reports intermittent paresthesias in his fingertips, especially at night. Which of the following anatomical assessment approaches best addresses the immediate clinical challenge and potential underlying etiologies? Option A. A comprehensive assessment of the brachial plexus, subclavian artery and vein, and the musculature of the rotator cuff and deltoid, correlating tenderness, range of motion deficits, and paresthesias with the known anatomical pathways and innervations. Option B. Focusing solely on the palpation findings of the supraspinatus tendon and initiating treatment for tendinitis. Option C. Prescribing a course of non-steroidal anti-inflammatory drugs, NSAID, and recommending rest, with follow-up in 2 weeks if symptoms persist. Option D. Immediate referral for an MRI of the cervical spine to rule out disc herniation as the primary cause of the arm symptoms. The correct answer is A. A comprehensive assessment of the brachial plexus, subclavian artery and vein, and the musculature of the rotator cuff and deltoid, correlating tenderness, range of motion deficits, and paresthesias with the known anatomical pathways and innervations. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a patient presenting with symptoms that could indicate a serious underlying condition requiring immediate intervention. The physician must quickly and accurately assess the situation, considering the patient's history, physical examination findings, and potential anatomical explanations for the symptoms. The risk of misdiagnosis or delayed diagnosis is high, potentially leading to adverse patient outcomes. Correct approach analysis. The correct approach involves a systematic and thorough anatomical assessment, correlating the patient's reported pain and physical findings with the known neurovascular and musculoskeletal structures of the affected region. This aligns with the core principles of osteopathic medicine, emphasizing the interconnectedness of body systems and the importance of a comprehensive physical examination to identify somatic dysfunctions. Specifically, understanding the innervation and vascular supply of the shoulder girdle and upper limb is critical for differentiating between various causes of radiating pain, such as rotator cuff pathology, nerve impingement e.g., thoracic outlet syndrome, or referred pain from cervical structures. This approach prioritizes patient safety and accurate diagnosis by leveraging foundational gross anatomy knowledge. Incorrect approach is analysis. One incorrect approach would be to immediately prescribe pain medication without a thorough anatomical correlation. This fails to address the root cause of the patient's symptoms and could mask a more serious underlying condition, delaying necessary treatment and potentially leading to further complications. This represents a failure to adhere to the principle of diagnosing and treating the cause, not just the symptom. Another incorrect approach would be to focus solely on a single anatomical structure, without considering the broader regional anatomy and potential referred pain patterns. For instance, attributing all arm pain solely to a specific muscle, without evaluating the surrounding nerves, blood vessels, and cervical spine, would be an incomplete and potentially erroneous assessment. This demonstrates a lack of comprehensive anatomical understanding and a failure to consider differential diagnoses. A third incorrect approach would be to rely solely on imaging studies without a strong clinical and anatomical correlation. While imaging is a valuable tool, it should complement, not replace, a thorough physical examination and anatomical reasoning. Ordering extensive and potentially unnecessary imaging without a clear anatomical hypothesis based on the physical exam can lead to increased costs, patient anxiety, and the risk of incidental findings that may not be clinically relevant. This approach bypasses the essential clinical reasoning process grounded in gross anatomy. Professional reasoning. Professionals should approach such a scenario by first gathering a detailed patient history, including the onset, character, location, and radiation of pain. This should be followed by a comprehensive physical examination, focusing on palpation, range of motion, neurological assessment, and specific orthopedic tests relevant to the shoulder and cervical spine. The physician should then integrate these findings with their knowledge of gross anatomy, considering the relationships between muscles, nerves, blood vessels, and bones in the affected region. This systematic process allows for the development of a differential diagnosis, guiding further investigation and treatment. Question 11. Implementation of a novel, investigational cellular therapy for a patient with a progressive, incurable osteopathic condition is being considered. The patient, fully informed of the experimental nature, potential risks, and lack of guaranteed efficacy, expresses a strong desire to proceed. The therapy is currently in phase I clinical trials at an affiliated research institution, and the patient meets all inclusion criteria. The physician must decide on the appropriate course of action. Option A. Administer the investigational cellular therapy under the approved clinical trial protocol, ensuring all informed consent requirements are met and documented. Option B. Proceed with administering the investigational cellular therapy immediately, bypassing the formal clinical trial protocol to expedite treatment for the patient. Option C. Decline to administer the therapy, citing its experimental status and the lack of established efficacy, and continue with palliative care only. Option D. Refer the patient to a different physician who is more willing to administer experimental treatments outside of formal research protocols. The correct answer is A. Administer the investigational cellular therapy under the approved clinical trial protocol, ensuring all informed consent requirements are met and documented. Explanation. This scenario presents a professional challenge related to the ethical and regulatory considerations surrounding the use of experimental therapies in a patient with a life-limiting condition. The physician must balance the patient's desire for treatment with the established standards of care and the regulatory framework governing clinical trials and experimental interventions. Careful judgment is required to ensure patient safety, informed consent, and adherence to the principles of osteopathic medicine, which emphasize the interconnectedness of body, mind, and spirit, and the importance of treating the whole person. The correct approach represents best professional practice because it prioritizes patient autonomy and safety within the established regulatory framework. Obtaining informed consent, which includes a thorough explanation of the experimental nature of the therapy, potential risks and benefits, and alternative treatment options, is a fundamental ethical and regulatory requirement. Adhering to the established protocol for the clinical trial ensures that the treatment is administered under controlled conditions, maximizing the potential for accurate data collection and minimizing undue risk to the patient. This aligns with the osteopathic principle of doctor as teacher, empowering the patient with knowledge to make informed decisions. An incorrect approach that involves administering the experimental therapy without full informed consent would be a significant regulatory and ethical failure. This violates the patient's right to self-determination and exposes them to risks without their full understanding or agreement. It also contravenes federal regulations, e.g., FDA regulations in the U.S., that mandate informed consent for participation in research or the use of unapproved therapies. Another incorrect approach, such as withholding the experimental therapy solely due to its unproven nature without considering the patient's informed request and the potential for benefit, could be seen as a failure to uphold the osteopathic principle of first do no harm by potentially denying a patient a treatment that, while experimental, might offer a chance for improvement. It also fails to adequately consider the patient's expressed wishes and their right to explore all available options, even those outside the standard of care, provided they are pursued ethically and with appropriate safeguards. The professional decision-making process for similar situations should involve a thorough assessment of the patient's condition, prognosis, and wishes. This should be followed by a comprehensive review of available evidence regarding the experimental therapy, including its mechanism of action, preclinical data, and any available human trial data. Consultation with institutional review boards, ERB, or ethics committees, as well as relevant specialists, is crucial. The physician must then engage in a detailed discussion with the patient and their family, ensuring complete understanding of the experimental nature, potential benefits, significant risks, and alternatives. The decision to proceed should be a shared one, documented meticulously, and always within the bounds of applicable regulations and ethical guidelines. Question 12. Stakeholder feedback indicates a need to reinforce the accurate application of anatomical terminology and planes in clinical documentation. A resident physician is documenting a physical examination, finding of a lesion on the anterior aspect of the right forearm, approximately midway between the elbow and the wrist. Which of the following descriptions best utilizes standard anatomical terminology and planes for precise documentation? Option A. A lesion is observed on the right forearm in the midsagittal plane. Option B. A lesion is present on the anterior aspect of the right forearm, approximately at the midpoint. Option C. A lesion is noted on the front of the right arm in the middle. Option D. A lesion is visualized on the right arm, superior to the elbow and inferior to the wrist. The correct answer is C. A lesion is noted on the front of the right arm in the middle. Explanation. This scenario presents a professional challenge due to the critical need for precise anatomical communication in a clinical setting, particularly during patient assessment and documentation. Misinterpretation of anatomical terms or planes can lead to diagnostic errors, inappropriate treatment planning, and potential patient harm. The Osteopathic Medical Licensing Examination, Level 1, emphasizes foundational knowledge, including accurate anatomical terminology and understanding of spatial relationships, as these are fundamental to safe and effective patient care. The correct approach represents best professional practice because it demonstrates a thorough understanding of anatomical planes and their application in describing patient anatomy. Utilizing standard anatomical terminology and planes ensures clarity and consistency in communication among healthcare professionals, which is a cornerstone of patient safety and effective team-based care. This aligns with the ethical obligation to provide competent care and the regulatory expectation of maintaining accurate medical records, as mandated by the standards governing osteopathic medical practice in the United States. An incorrect approach that relies on colloquial or imprecise descriptions fails to meet professional standards. Such ambiguity can lead to misinterpretation by other clinicians, potentially resulting in incorrect diagnoses or treatments. This constitutes a failure to adhere to the principles of clear and accurate medical communication, which is implicitly required by the standards of practice and the ethical duty to avoid causing harm. Another incorrect approach that uses terms without a clear understanding of their anatomical context, such as confusing anterior with superior, introduces significant potential for error. This demonstrates a lack of foundational anatomical knowledge, which is a direct violation of the competency expected of a licensed osteopathic physician and a failure to meet the standards of care. A third incorrect approach that avoids using specific anatomical planes altogether, opting for vague directional terms, also falls short. While not as egregious as outright misnaming, it hinders precise localization of findings and can obscure important clinical details. This lack of specificity compromises the quality of documentation and communication, impacting continuity of care and potentially leading to suboptimal patient management. The professional decision-making process for similar situations should involve a systematic approach. First, accurately identify the anatomical structure or region in question. Second, determine the most appropriate and precise anatomical term to describe its location or orientation. Third, consider the relevant anatomical planes, sagittal, coronal, transverse, that best facilitate clear and unambiguous communication of the finding. Finally, always prioritize clarity, accuracy, and consistency in all forms of medical communication, whether verbal, written, or in diagnostic imaging interpretation, to ensure optimal patient outcomes and uphold professional standards. Question 13. The performance metrics show a significant increase in patient relapse rates for a chronic inflammatory condition, despite adherence to standard treatment protocols. A review of the underlying pathophysiology reveals that the condition is heavily influenced by the JAK-STAT signaling pathway. Which of the following therapeutic strategies, when considering the molecular mechanisms of this pathway, would be most appropriate to investigate for improving patient outcomes? Option A. Initiation of physical therapy focused on improving joint mobility and reducing pain. Option B. Development of novel small molecule inhibitors that specifically target the activation of STAT proteins downstream of JAK kinases. Option C. Administration of broad-spectrum antibiotics to address potential underlying microbial triggers. Option D. Prescription of high-dose corticosteroids to suppress general immune system activity. The correct answer is B. Development of novel small molecule inhibitors that specifically target the activation of STAT proteins downstream of JAK kinases. Explanation: the performance metrics show a concerning trend in patient outcomes related to a specific chronic inflammatory condition. This scenario is professionally challenging because it requires the osteopathic physician to move beyond simply treating symptoms and delve into the underlying molecular mechanisms driving the disease. The physician must integrate knowledge of cellular biology and pharmacology to understand how signal transduction pathways are dysregulated and how therapeutic interventions can modulate these pathways. Careful judgment is required to select the most appropriate diagnostic and therapeutic strategies based on the complex interplay of cellular signaling. The correct approach represents best professional practice because it directly addresses the root cause of the observed performance metrics by focusing on the molecular mechanisms of disease. Understanding the specific signal transduction pathways involved in the inflammatory condition allows for targeted therapeutic interventions. This aligns with the osteopathic principle of treating the whole person and addressing the underlying causes of disease, rather than just the manifestation. Furthermore, staying abreast of advancements in molecular biology and pharmacology is a core competency for osteopathic physicians, ensuring evidence-based and effective patient care, consistent with the standards of practice expected by licensing bodies. An incorrect approach that focuses solely on symptomatic relief without investigating the underlying pathway dysregulation fails to address the fundamental problem, potentially leading to suboptimal long-term outcomes and continued poor performance metrics. This represents a failure to adhere to the principle of addressing the root cause of illness. Another incorrect approach that relies on outdated or unproven therapeutic modalities, without considering current scientific understanding of signal transduction, would violate ethical obligations to provide evidence-based care and could expose patients to ineffective or harmful treatments. This constitutes a failure to maintain professional competence and adhere to accepted medical standards. A third incorrect approach that neglects to consider the patient's individual genetic predispositions or variations in signaling pathway components would be a failure to personalize medicine, potentially leading to ineffective treatment and missed opportunities for optimization, thus not representing the highest standard of care. The professional decision-making process for similar situations should involve a systematic evaluation of patient data, including performance metrics, to identify areas for improvement. This should be followed by a thorough review of the underlying pathophysiology of the condition, with a specific focus on relevant signal transduction pathways. The physician should then consult current scientific literature and clinical guidelines to identify evidence-based diagnostic and therapeutic options that target these pathways. Finally, the physician must consider the individual patient's needs and characteristics when formulating a treatment plan, ensuring a personalized and effective approach. Question 14. Operational review demonstrates a biopsy specimen from a patient presenting with unexplained fatigue and elevated liver enzymes. Microscopic examination reveals cells with abundant smooth endoplasmic reticulum and a notable scarcity of rough endoplasmic reticulum. These cells also exhibit prominent glycogen granules. Which of the following cellular features, when considered in conjunction with the organ of origin, most strongly suggests a primary role in lipid metabolism and detoxification? Option A, the presence of extensive Golgi apparatus and secretory vesicles. Option B, the presence of numerous lysosomes and peroxisomes. Option C, the high density of mitochondria and cristae. Option D, the abundance of smooth endoplasmic reticulum and scarcity of rough endoplasmic reticulum. The correct answer is B, the presence of numerous lysosomes and peroxisomes. Explanation: scenario analysis. This scenario presents a challenge in differentiating between normal cellular structures and pathological changes within a tissue sample, requiring a strong foundation in microscopic anatomy. The physician must accurately identify the observed cellular morphology to determine the underlying cause of the patient's symptoms, which directly impacts diagnosis and treatment planning. Misinterpretation can lead to incorrect diagnoses, delayed or inappropriate interventions, and potential patient harm. Correct approach analysis. The correct approach involves recognizing the characteristic features of the observed cells and organelles within the context of the organ's normal microscopic anatomy. For example, identifying the presence of abundant smooth endoplasmic reticulum and the absence of rough endoplasmic reticulum in specific cells would strongly suggest a role in lipid metabolism and detoxification, consistent with hepatocytes. This aligns with the osteopathic principle of understanding the body as an integrated whole, where cellular structure dictates function and is crucial for diagnosing disease. The Comprehensive Osteopathic Medical Licensing Examination Level 1, COMLEX Level 1, emphasizes this foundational knowledge of microscopic anatomy as a cornerstone of medical practice. Incorrect approaches analysis. One incorrect approach would be to focus solely on the presence of abnormal-looking cells without correlating them to the specific organ and its normal histological features. This could lead to a generalized diagnosis of inflammation or atypia without pinpointing the specific cellular pathology or its organ of origin, failing to leverage the diagnostic power of comparative microscopic anatomy. Another incorrect approach would be to attribute the observed cellular features to a generic cellular process, such as increased protein synthesis, without considering the specific organ's known functions and typical cellular machinery. For instance, attributing abundant smooth endoplasmic reticulum solely to protein synthesis ignores its primary roles in lipid metabolism and detoxification, which are key functions of certain cell types. A third incorrect approach would be to rely on external resources or consult colleagues without first attempting to apply foundational knowledge of microscopic anatomy. While collaboration is valuable, the initial diagnostic step relies on the physician's ability to interpret microscopic findings based on their training and understanding of normal histology. This failure to apply core knowledge represents a deficiency in the fundamental diagnostic skills tested by COMLEX Level 1. Professional reasoning. Professionals should approach such scenarios by systematically evaluating the microscopic features. This involves 1. Identifying the tissue and organ of origin. 2. Recalling the normal microscopic anatomy of that organ, including the characteristic morphology of its constituent cells and their organelles. 3. Comparing the observed features to the known normal structures, noting any deviations. 4. Correlating these deviations with potential pathological processes based on the organ's function. This systematic process ensures accurate interpretation and facilitates appropriate clinical decision-making. Question 15. Investigation of a fetal tissue biopsy reveals an unusual arrangement of mesenchymal cells and a prominent basement membrane surrounding developing glandular structures. The physician must determine if these findings represent a normal stage of organogenesis or potential developmental anomaly. Which of the following histological interpretations is most consistent with normal developmental histology in this context? Option A. The prominent basement membrane suggests a significant defect in extracellular matrix production, indicative of a congenital disorder. Option B. The unusual cellular arrangement points to a failure of cell differentiation, a hallmark of early-stage tumorigenesis. Option C. The observed cellularity and basement membrane characteristics are typical of early mesenchymal condensation and epithelial-mesenchymal interactions during organ formation. Option D. The increased mesenchymal cell density indicates a reactive stromal response to an unknown inflammatory process. The correct answer is C. The observed cellularity and basement membrane characteristics are typical of early mesenchymal condensation and epithelial-mesenchymal interactions during organ formation. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the physician to integrate knowledge of normal developmental histology with the interpretation of a potentially abnormal finding in a pediatric patient. The challenge lies in distinguishing between normal variations in developing tissues and true pathological processes, which has direct implications for diagnosis and patient management. Accurate assessment is crucial to avoid unnecessary interventions or delayed treatment. Correct approach analysis. The correct approach involves a systematic evaluation of the histological specimen, comparing the observed cellular and tissue morphology against established patterns of normal embryonic and fetal development. This aligns with the core competencies expected of physicians, particularly in interpreting diagnostic findings. The osteopathic principles emphasize a holistic understanding of the patient, which includes appreciating the dynamic nature of development. This approach is best professional practice as it is evidence-based, patient-centered, and directly addresses the diagnostic question posed by the histological findings. It adheres to the ethical obligation to provide competent medical care. Incorrect approach is analysis. One incorrect approach would be to immediately assume a pathological process based on any deviation from adult histological norms. This fails to acknowledge the inherent variability and ongoing changes in developing tissues. Such an approach could lead to misdiagnosis, unnecessary anxiety for the patient and family, and potentially harmful interventions. This represents a failure in diagnostic reasoning and a deviation from the standard of care, which requires careful consideration of developmental context. Another incorrect approach would be to dismiss the findings as insignificant without thorough histological analysis and comparison to developmental atlases or literature. This demonstrates a lack of diligence and could result in overlooking a serious underlying condition. It violates the ethical duty to thoroughly investigate patient conditions and could lead to delayed diagnosis and treatment, causing harm. A third incorrect approach would be to rely solely on anecdotal experience or personal bias without consulting established scientific literature or seeking expert consultation. While experience is valuable, it must be grounded in scientific evidence. This approach risks perpetuating misinformation and can lead to diagnostic errors, failing to uphold the professional standard of care which mandates evidence-based practice. Professional reasoning. Professionals should approach such scenarios by first establishing the clinical context and the reason for the histological examination. Then they must systematically analyze the specimen, employing their knowledge of normal histology at different developmental stages. This involves meticulous observation of cellular structure, tissue organization, and the presence or absence of specific developmental markers. Comparison with reliable reference materials, and if necessary, consultation with specialists are critical steps. The decision-making process should prioritize patient well-being, accuracy of diagnosis, and adherence to ethical and professional standards. Question 16. What factors determine the appropriate course of action when a patient with a newly diagnosed endocrine disorder expresses a strong preference for a treatment option that the osteopathic physician believes is suboptimal and potentially less effective than other available therapies? Option A. The availability of alternative treatments and the patient's insurance coverage for those options. Option B. The physician's personal experience with similar cases and their preferred treatment modality for the specific endocrine disorder. Option C. The patient's understanding of the condition and treatment options, the physician's assessment of the risks and benefits of each option, and the patient's personal values and goals for their health. Option D. The perceived urgency of the condition and the physician's professional opinion on the single best treatment, regardless of patient input. The correct answer is C. The patient's understanding of the condition and treatment options, the physician's assessment of the risks and benefits of each option, and the patient's personal values and goals for their health. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's stated wishes and the physician's ethical and professional obligation to provide the best possible care, especially when those wishes might lead to suboptimal outcomes or potential harm. The physician must navigate the patient's autonomy while also considering their well-being and the established standards of osteopathic medical practice. The correct approach emphasizes shared decision-making, patient education, and exploring underlying reasons for the patient's preferences. This aligns with the core principles of osteopathic medicine, which stress the importance of the patient-physician relationship, respect for patient autonomy, and the physician's duty to inform and guide. Specifically, it upholds the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, by ensuring the patient is fully informed and that their decision is made with a complete understanding of the implications. Regulatory frameworks for medical licensing, such as those overseen by the NBOM for the COMLEX USA, implicitly support this approach by requiring physicians to practice competently, ethically, and with respect for patient rights. An incorrect approach that solely prioritizes the patient's initial, potentially uninformed, request without further exploration fails to uphold the physician's duty of care and the principle of beneficence. It risks allowing a patient to make a decision that could be detrimental to their health due to a lack of understanding or misinformation, which is a regulatory and ethical failure. Another incorrect approach that dismisses the patient's concerns outright and imposes a treatment plan disregards patient autonomy, a fundamental ethical and often legally protected right. This can lead to a breakdown in the patient-physician relationship and potential complaints or disciplinary actions related to patient rights and informed consent. A third incorrect approach that focuses solely on the physician's personal beliefs or convenience, rather than the patient's medical needs and preferences, represents a significant ethical lapse and a failure to adhere to professional standards of practice. The professional decision-making process in such situations should involve 1. Actively listening to and understanding the patient's concerns and preferences. 2. Providing clear, comprehensive, and understandable information about the condition, treatment options, risks, benefits, and alternatives. 3. Exploring the patient's values, goals, and any underlying reasons for their preferences. 4. Collaboratively developing a treatment plan that respects the patient's autonomy while ensuring their well-being and documenting this process thoroughly. Question 17. When evaluating a patient presenting with dyspnea and a history of chronic obstructive pulmonary disease, COPD, which of the following approaches best facilitates informed consent regarding a proposed bronchodilator therapy? Option A. Explaining how the bronchodilator works by relaxing the smooth muscles in the airways, leading to bronchodilation and improved airflow, and how this directly addresses the patient's difficulty breathing due to narrowed airways. Option B. Presenting a detailed diagram of the alveolar capillary membrane and discussing the effects of inflammation on gas exchange. Option C. Stating that the medication will make breathing easier without delving into the specific physiological mechanisms involved. Option D. Informing the patient that the medication is a standard treatment for COPD and is generally effective, without elaborating on the physiological basis of its action. The correct answer is A. Explaining how the bronchodilator works by relaxing the smooth muscles in the airways, leading to bronchodilation and improved airflow, and how this directly addresses the patient's difficulty breathing due to narrowed airways. Explanation. This scenario presents a professional challenge because it requires the physician to integrate knowledge of respiratory physiology with the ethical and legal obligations of patient care, specifically regarding informed consent and the physician's duty to provide accurate information. The physician must not only understand the physiological mechanisms of breathing, but also how to communicate complex medical information in a way that empowers the patient to make informed decisions about their treatment. The correct approach represents best professional practice because it prioritizes patient autonomy and the principle of informed consent, which are cornerstones of medical ethics and are implicitly supported by the regulatory framework governing medical practice in the United States, as this exam is U.S.-based. Providing a clear, understandable explanation of the physiological impact of the condition and the rationale behind the proposed treatment allows the patient to grasp the implications of their choices. This aligns with the physician's duty to act in the patient's best interest while respecting their right to self-determination. An incorrect approach that focuses solely on the technical physiological details without translating them into patient-understandable terms fails to adequately inform the patient. This can lead to a lack of true understanding and, consequently, an uninformed decision, which is a breach of the physician's ethical duty. Another incorrect approach that oversimplifies the physiological explanation to the point of being misleading or inaccurate is also professionally unacceptable. This not only undermines informed consent, but also erodes patient trust and can lead to inappropriate treatment decisions. Finally, an approach that avoids discussing the physiological basis altogether, perhaps due to time constraints or perceived complexity, neglects a crucial component of patient education and shared decision-making, thereby failing to meet the standard of care. The professional reasoning process in such situations involves a multi-step approach. First, the physician must accurately assess the patient's condition and understand the underlying physiological processes. Second, they must translate this complex physiological information into clear, concise, and understandable language tailored to the patient's health literacy level. Third, they must explain the implications of the condition and the rationale for proposed interventions, including potential benefits and risks from a physiological perspective. Fourth, they must actively engage the patient in a dialogue, allowing for questions and ensuring comprehension, thereby facilitating truly informed consent. Question 18. The monitoring system demonstrates a transient, localized increase in sympathetic nervous system activity, evidenced by a slight increase in heart rate and superficial skin temperature during palpation of the superior nuptial line and occipital base in a patient receiving OMT for cervicothoracic somatic dysfunction. The osteopathic physician is employing a direct, high-velocity, low-amplitude technique to address a restricted atlanto-occipital joint. Which of the following anatomical considerations best explains this observed physiological response and guides the physician's next step? Option A. The direct pressure on the trapezius muscle fibers could trigger a localized inflammatory response, causing increased blood flow and a compensatory parasympathetic surge to manage the perceived tissue damage. Option B. The manipulation near the atlanto-occipital articulation may inadvertently stimulate the vertebral artery or associated sympathetic plexus, leading to a transient sympathetic response as the body attempts to maintain homeostasis. Option C. The stimulation of the greater occipital nerve, a branch of the trigeminal nerve, can elicit a parasympathetic reflex leading to decreased heart rate and vasodilation, which is inconsistent with the observed sympathetic activation. Option D. The application of the technique is likely causing direct mechanical irritation to the phrenic nerve, resulting in diaphragmatic spasms and a subsequent vagal nerve stimulation that would manifest as bradycardia. The correct answer is C. The stimulation of the greater occipital nerve, a branch of the trigeminal nerve, can elicit a parasympathetic reflex leading to decreased heart rate and vasodilation, which is inconsistent with the observed sympathetic activation. Explanation. The monitoring system demonstrates a subtle but potentially significant deviation in a patient's physiological response during a routine osteopathic manipulative treatment (OMT) session. The challenge lies in accurately interpreting this deviation within the context of regional anatomy and distinguishing between a normal physiological adaptation and a sign of potential complication or misapplication of technique. This requires a deep understanding of the interconnectedness of anatomical structures and their expected responses to osteopathic intervention. The correct approach involves a systematic evaluation of the observed deviation, correlating it with the specific anatomical region being treated and the osteopathic principles being applied. This necessitates a thorough knowledge of the neuromusculoskeletal system, including the location of nerves, blood vessels, muscles, and bony landmarks, and how manipulation of one structure can influence others. Best professional practice, as guided by the principles of osteopathic medicine and the standards of care expected for the comprehensive osteopathic medical licensing examination level 1, mandates that the osteopathic physician prioritize patient safety and efficacy of treatment. This means recognizing when a response is within the expected physiological range and when it warrants further investigation or modification of the treatment plan. The physician must be able to articulate the anatomical rationale for both the observed response and the chosen intervention. An incorrect approach would be to dismiss the deviation without a proper anatomical correlation, potentially leading to an undertreated condition or an iatrogenic injury. Another incorrect approach is to overreact to a normal physiological response, leading to unnecessary patient anxiety or discontinuation of a beneficial treatment. Failing to consider the specific anatomical structures involved in the patient's presentation and the osteopathic technique being employed represents a failure to adhere to the core tenets of osteopathic practice. This can lead to a misdiagnosis of the underlying issue or an inappropriate application of OMT, violating the ethical obligation to provide competent and evidence-informed care. The professional decision-making process for similar situations should involve a continuous loop of assessment, diagnosis, treatment, and reassessment. When a deviation is observed, the physician must first consider the anatomical context. What structures are in this region? What is the expected physiological response to the manipulation applied to these structures? Is the observed response consistent with normal adaptation, or does it suggest a potential problem? This anatomical reasoning then informs the decision to either continue, modify, or terminate the treatment, always with the patient's well-being as the paramount concern. Question 19. The risk matrix shows a patient with a history of hypertension, type 2 diabetes, and obesity presenting with symptoms suggestive of Cushing's syndrome, including central obesity, moon phases, and stria. The patient is also taking several medications for their chronic conditions. Which of the following diagnostic approaches best balances the need for accurate diagnosis with minimizing patient risk and unnecessary interventions? Option A. Proceed directly to pituitary MRI to rule out a pituitary adenoma as the cause of hypercortisolism. Option B. Rely solely on a single morning serum cortisol level to confirm or exclude hypercortisolism. Option C. Initiate a low-dose dexamethasone suppression test, followed by ACT measurement and urinary-free cortisol if indicated, while carefully reviewing the patient's current medication list for potential interference. Option D. Attribute all new symptoms exclusively to the patient's existing comorbidities without further endocrine investigation. The correct answer is C. Initiate a low-dose dexamethasone suppression test, followed by ACT measurement and urinary-free cortisol if indicated, while carefully reviewing the patient's current medication list for potential interference. Explanation. This scenario presents a professional challenge due to the potential for misdiagnosis and inappropriate treatment of a complex endocrine disorder, specifically Cushing's syndrome, in a patient with a history of multiple comorbidities. The physician must integrate information from various diagnostic tests, patient history, and clinical presentation, while considering the impact of other medical conditions and their treatments on endocrine function. Careful judgment is required to avoid over- or undertreatment, which could lead to significant patient harm. The correct approach represents best professional practice by prioritizing a comprehensive diagnostic workup that accounts for the patient's complex medical history and potential confounding factors. This aligns with the principles of evidence-based medicine and patient-centered care, emphasizing thoroughness and accuracy in diagnosis. Specifically, the approach of initiating a low-dose dexamethasone suppression test followed by ACT measurement and urinary-free cortisol if indicated, while carefully considering the patient's current medications and comorbidities, demonstrates a systematic and cautious diagnostic strategy. This adheres to the ethical obligation to provide competent medical care and to avoid unnecessary interventions. An incorrect approach of immediately proceeding to imaging without a clear biochemical diagnosis would be a regulatory and ethical failure. This bypasses established diagnostic algorithms for Cushing syndrome, potentially leading to unnecessary radiation exposure and costs for the patient, and delaying definitive diagnosis and treatment. It also fails to acknowledge the possibility of pseudo-Cushing states, which can mimic Cushing syndrome but are related to other conditions like depression or alcoholism, or are influenced by medications. Another incorrect approach of solely relying on a single elevated cortisol level without further investigation is also professionally unacceptable. Endogenous cortisol levels fluctuate throughout the day, and a single measurement can be misleading. This approach neglects the need for dynamic testing and confirmation, which is crucial for accurate diagnosis of hypercortisolism. It violates the principle of due diligence in medical diagnosis and could lead to a false positive diagnosis, resulting in unnecessary and potentially harmful treatments. A further incorrect approach of attributing all symptoms solely to the patient's known comorbidities without considering the possibility of a new endocrine disorder is a failure to maintain an open differential diagnosis. While comorbidities can explain some symptoms, they do not preclude the development of other conditions. This approach risks missing a treatable endocrine disorder, thereby failing to provide optimal patient care and potentially allowing the underlying condition to progress. The professional reasoning process for similar situations should involve a systematic approach to diagnosis. This includes a thorough patient history, a comprehensive physical examination, and the formulation of a broad differential diagnosis. Based on the initial assessment, appropriate diagnostic tests should be ordered in a stepwise manner, starting with less invasive and more cost-effective options. The results of these tests should be interpreted in the context of the patient's overall clinical picture, including their comorbidities and current medications. If a diagnosis remains uncertain, further specialized testing or consultation with an endocrinologist should be pursued. This iterative process ensures that diagnostic decisions are evidence-based, patient-centered, and ethically sound, minimizing risks and maximizing the likelihood of an accurate diagnosis and effective treatment. Question 20. The assessment process reveals a 45-year-old male presenting with insidious onset of bilateral posterior thigh pain, exacerbated by prolonged sitting and relieved by standing. He denies any history of trauma or recent strenuous activity. He reports mild stiffness in the morning that resolves within 30 minutes. Physical examination reveals mild tenderness to palpation over the hamstrings bilaterally, with full range of motion in hip and knee joints. Straight leg raise is negative bilaterally. Lumbar spine examination is unremarkable. Which of the following diagnostic and management strategies is most appropriate at this juncture? Option A. Prescribe a short course of oral corticosteroids to reduce inflammation and alleviate pain. Option B. Order immediate magnetic resonance imaging (MRI) of the lumbar spine to rule out radiculopathy. Given the posterior thigh pain, option C. Refer the patient to a physical therapist for aggressive manual therapy techniques without further diagnostic imaging. Option D. Initiate a trial of conservative management including stretching exercises for the hamstrings and advice on ergonomic modifications for his workstation, with a follow-up appointment scheduled in 4 weeks to reassess symptoms. The correct answer is D. Initiate a trial of conservative management, including stretching exercises for the hamstrings and advice on ergonomic modifications for his workstation, with a follow-up appointment scheduled in 4 weeks to reassess symptoms. Explanation. This scenario presents a professionally challenging situation due to the need to balance immediate patient comfort and symptom relief with the imperative of accurate diagnosis and appropriate treatment planning. The physician must avoid premature conclusions based solely on subjective complaints and instead employ a systematic, evidence-based approach to musculoskeletal assessment. The correct approach represents best professional practice because it adheres to the fundamental principles of osteopathic medical assessment, emphasizing a thorough history, comprehensive physical examination, and consideration of differential diagnoses. This systematic process ensures that all potential contributing factors to the patient's pain are evaluated, leading to a more accurate diagnosis and effective, individualized treatment plan. This aligns with the osteopathic tenet of treating the whole person and the ethical obligation to provide competent and comprehensive care. An incorrect approach that focuses solely on immediate pain relief without a comprehensive diagnostic workup fails to address the underlying pathology, potentially masking serious conditions or leading to ineffective treatment. This could be considered a failure in due diligence and a deviation from established medical standards of care. Another incorrect approach that relies on a single diagnostic modality without considering the broader clinical picture risks misdiagnosis and inappropriate management, violating the principle of providing evidence-based care. A third incorrect approach that dismisses the patient's symptoms without adequate investigation is ethically problematic, as it fails to respect the patient's experience and can erode trust in the physician-patient relationship. The professional decision-making process for similar situations should involve a structured approach. 1. Elicit a detailed patient history, including onset, duration, character, location, aggravating and alleviating factors, and any associated symptoms. 2. Perform a comprehensive physical examination, including observation, palpation, range of motion assessment, and specific orthopedic tests relevant to the suspected musculoskeletal issue. 3. Develop a differential diagnosis based on the history and physical exam findings. 4. Order appropriate diagnostic imaging or laboratory tests if indicated to confirm or rule out specific diagnoses. 5. Formulate a treatment plan that addresses the diagnosed condition and the patient's individual needs and goals, prioritizing safety and efficacy.